Hello, I am Marcos Gomez Ruiz. I am research coordinator for Mircast study, and I would like to thank the European Society of Coloproctology for supporting Mircast and for giving us the opportunity to participate in the Global Reach webinar. The mini-invasive right colectomy study is a prospective, observational, multicenter, four-cohort study comparing laparoscopic and robotic-assisted right colectomies with intracorporeal anastomosis versus extracorporeal anastomosis. The objective of the study is to compare the perioperative complications after robotic-assisted and laparoscopic mini-invasive right colectomies and after intracorporeal anastomosis and extracorporeal anastomosis after these right colectomies. The aim of the study is also to identify potential robotic benefits of robotic assisted procedures in right colon resections. The study has criteria for the centers that participate in the study. The centers should have enough experience of more than 30 cases before including the first patient in the study, in the technique they are participating in. And they should have some support for research, research nurse or research team and research experience before participating in the study. The research team for Mircast study has developed a questionnaire that all the centers have to fill in before participating in the study, so we are able to assess that these centers meet the criteria. The study design has four parallel cohorts. One of the cohorts is the laparoscopic assisted right colectomy with intracorporeal anastomosis. Another one is laparoscopic assisted right colectomy with extracorporeal anastomosis. And the other two are robotic assisted right colectomy with intracorporeal anastomosis and robotic assisted right colectomy with extracorporeal anastomosis. The primary endpoint of the study is assessing the surgical method, defining the efficacy of the surgical method with co-primary endpoints, looking into surgical site infection and severe complications based on the Clavian-Dindo classification, grade 3, grade 4. There are a big number of secondary endpoints which look to different perioperative outcomes and intraoperative outcomes. Items like OR time, conversion rate, or in the postoperative period, the length of stay, the inflammatory response syndrome assessed with CRP or procalcitonin, or midterm outcomes like ventral hernias or local recurrence are also assessed in the study. Some pathological outcomes or the degree of lymphadenectomy is also assessed, with the limitations that any of these observational multicenter studies would have, but keeping an eye into the performance of CME and D3 lymphadenectomy while not being the primary aim of the study. The study inclusion is quite simple. The inclusion criteria are an age of 18 years or higher, the existence of a tumor in the right colon with an indication for right colectomy, an expectancy of life bigger than 3 months, an ECOG score equal or below 2, and that the patient is willing to sign and signs the informed consent and is willing to perform the 2-year follow-up required for the study. The number of patients that the study aims to recruit is around 1,200, and the number of centers required for those patients is around 40 centers divided into 7 to 10 geographical European countries. So far, the study has recruited more than 800 patients, and currently the laparoscopic right colectomy with intracorporeal anastomosis cohort is being closed because of the complete recruitment in this cohort. We are encouraging centers doing laparoscopic extracorporeal anastomosis to participate in the study, because this is the group of patients in which we are having more difficulties to find centers that are willing to participate, and is the group of patients that requires currently more patients to be recruited. We are again very thankful for the endorsement, for the support that the ESCP has done to Mircast study, and to the implications and the involvement that ESCP is having in areas like the quality assessment of the study, or in the performance of snapshot studies in the right colon cancer treatment, looking into how we treat the right colon cancer in Europe, and also allowing us to have an active screening log to compare our population with the population of those ESCP snapshot audits. I think that the good thing of these collaborative studies is that they really allow us to make big progress in research in Europe and in the world. During the Global Reach webinar, we were able to discuss and comment the huge benefits of these international collaborations. Studies like Mircast or like Reset or Eagle and many other collaborative projects are, I think, instrumental to create evidence in the field of colorectal surgery. And I think that it would definitely take us much longer, or might even be impossible, to create this evidence in the field of surgery without these collaborative projects. And I think that this is the way in which collaborative, international, or even global projects are so important. Thank you so much for, again, this invitation to comment on the study, to present the study, and we think that the importance of all these collaborative projects, and stay safe.